Hi everybody, my name is Kim and I'm a patient care specialist at Apollo Clinics. And today in our 9th episode in the Medical Cannabis Now series, we'll be talking about sleep, insomnia, and using medical cannabis. Sleep disorders are one of the most common health problems affecting our population today and can be a result of stress or another health issue. It mostly affects adults, but many high school students also report some form of a sleep problem. The most common sleep disorder is insomnia. The others include sleep-related breathing problems, parasomnias such as sleepwalking, sleep-related movement disorders, and circadian rhythm sleep-wake disorders. Many patients at Apollo Clinics often complain of sleep disturbance as a part of their medical condition, and for some, it is a primary reason for their visit. There are many medical cannabis strains and products with different balance ratios of THC and CBD that can help with sleep. Our patients come to the clinic on many sleep medications, including zopiclone, trazodone, or benzodiazepines. They usually have already made lifestyle changes, but to no avail. Their sleep disorder is often associated with chronic pain conditions, PTSD, and other mental health concerns. It can seriously affect one's quality of life, their relationship with others, and their ability to heal and recover. Using medical cannabis has many benefits, and one of them is the possibility of treating many different symptoms at once. While treating other medical conditions, a common secondary outcome is the improvement of sleep. For example, if a patient is using cannabis for anxiety and they are less anxious, they are able to have better sleep, which then in turn improves their mood during the day. So it's a nice full circle. When looking at a percentage of Apollo patients suffering from sleep disturbances, there were significant improvements in areas of sleep latency or initiating sleep, sleep duration, and sleep quality while using medical cannabis. More research, however, is needed to better understand how and why cannabinoids affect sleep. The endocannabinoid system occurs naturally in our bodies, and they play a role in the balance of many organ systems. It is thought that this endocannabinoid system plays a role in the induction and the quality of sleep, which may be a reason why cannabis can help. So the key factor in using medical cannabis for sleep is appropriate dosing and strain selection, which we will now dive into. It is recommended that for sleep, patients incorporate THC. THC is a major cannabinoid in cannabis that can be psychoactive. There are many theories and studies that show THC can affect slow wave sleep, and this phase of sleep is involved with learning and memory. The effects of THC on sleep are also dose dependent. So a study showed that a low dose of THC improves sleep onset, while a higher dose may affect the time it takes to go to sleep. When consuming THC at night, it can start as a stimulant, but with time, the metabolites produced by THC are sedating. This is why we often recommend consuming your therapeutic dose a few hours before bed. And THC also has a profound effect on patients suffering from post-traumatic stress disorder. We found that it can dramatically decrease the nightmares these patients suffer from and keep them asleep for longer. It's important to note that THC does not always mean a patient has to feel high. If you are concerned about feeling high, it's important to consult with a healthcare professional to find the appropriate dose to manage your symptoms without feeling any negative effects. So while THC is known to assist with sleep, little is known about CBD's effects. CBD is a cannabinoid cannabis that is considered non-psychoactive and therefore used by patients in the daytime. However, CBD used for sleep is patient and dose dependent. It is thought that for patients who suffer from fatigue, they will find that CBD improves their sleep. But for patients who feel well rested, they will find that it can help with energy in the daytime. It is recommended to use high doses of CBD during the day to reduce the background noise and stress, which translates to a more relaxed state when it comes time to sleep, resulting in better quality sleep. Alternatively, many of our patients actually use CBD before bedtime and find that it also helps them to have a more restful sleep. There are many ways to consume cannabis for sleep, and despite popular belief, a patient doesn't have to smoke their medication to manage symptoms. For better sleep quality and duration, it is best to consume cannabis oil. Many cannabis oils take time to have an effect, but those effects are longer lasting. It is recommended to consume oil 1 to 2 hours before bed, and this varies from patient to patient. Vaporizing dried cannabis is a faster delivery system, but the effects don't last as long as an oil. And some patients will actually vaporize to fall asleep, but also take the oil at the same time in order to increase their sleep duration and their sleep quality. There's a lot of talk about indica, sativa, and hybrids, and there is much debate over the different cannabis species and how they affect sleep. It is generally thought that the cannabis indica plant induces a more relaxing state and is better for sleep. However, we have found that this affects each patient differently. There are some that find cannabis sativa helps them sleep and is actually more sedating. And for some, cannabis sativa, cannabis indica, it doesn't matter. Terpenes, which affect the smell and the flavor of cannabis or of any naturally occurring plant, it's said to have a physiological effect, but their role is not as well researched. So here I want to share a quick case study of a 30-year-old male that had been using recreational cannabis for 10 plus years every day for sleep, and his sleep was due to insomnia and anxiety. Over time, he found that the THC may have been too high for him and that his product consistency was unreliable. So then he finds that his sleep then went backwards and he started where he began. So after coming in to see the doctor, and speaking with a patient care specialist, he started using a 3:2 CBD to THC ratio medical cannabis oil that was a hybrid strain. And the specific one is called Blue Oil from Spectrum Therapeutics. He started low and increased slowly over time, and he found that 0.6 milliliters on average 2 hours before sleep was the ideal dose. And after just 1 week of use, he reported improvements in his sleep quality and length of sleep. And then at his 1 month assessment, he reported a 70% improvement in his overall sleep, and he reported feeling less groggy in the morning. This complaint we get a lot from patients coming in using sleep medications. This scenario is quite common for our patients using cannabis for sleep, but every experience is different and their dosing needs are often different too. Near the end here, I want to share a few tips for using cannabis for sleep. It's important to stay hydrated when using cannabis, so I recommend having a glass of water by your bedside. Overall, we find that a THC to CBD combination yields a more consistent result. Now, research shows a moderate amount of evidence that cannabis can be effective for sleep. However, there are many factors involved, more research to be done, and of course, each patient may have a different experience. Many of our patients are concerned with side effects, and we do our best to find the right strain and minimal dose to manage symptoms. Therefore, it is always a good idea to consult with a healthcare professional first before starting medical cannabis. So thank you very much for listening. And of course, thank you for those who sent in questions, which I'll go over now. So our first question was, my friend uses cannabis for sleep. Will it also work for me? And can I try theirs? Now, every patient experience, as we have said, is different, especially when using for something like sleep. For example, it could work for you, but maybe you have to use a different strain than your friend. So we typically encourage patients to speak with a healthcare professional first. That way we can ensure what you are prescribed is best for you and that it will work alongside with many other medications that you might be taking. The second question we got is, can cannabis make you feel groggy in the morning like other sleep medications? And it can be if either used recreationally or too much is taken or just it's not the right strain for you. But this is why we work with each patient to find their ideal dose and make necessary adjustments along the way. Next question. If I'm using a certain strain and finding it's actually keeping me awake and not helping me with sleep, what can I do? Now, in this situation, we have to consider how much was taken, in what form, and what strain. Every strain has a different profile, and the best thing to do is to call your patient care specialist to discuss what wasn't working, any alternative product recommendations, and what the next steps are. Next question. I found using a small amount in a vaporizer has been really helpful before bed. Should I be using oils instead, or is the vaporizer okay? Now, the best thing about cannabis is that it is ultimately up to the patient what they want to do. Our job here is to provide guidance, and the doctor is there to provide more guidance and medical advice. However, it's up to the patient what they decide is best for them. If you feel that it is helping you sleep and you are happy with your routine, then it's okay. However, we have found that while vaporizing does help, adding a cannabis oil usually improves a patient's sleep quality and helps them to stay asleep longer. The results are usually beyond what the patient is expecting. Finally, our last question, will hemp CBD have the same effect as cannabis CBD for sleep assistance? And this depends. It is important to understand that there is a difference between hemp-derived CBD and cannabis-derived CBD. Cannabis-derived CBD is often more robust in terpenes and other cannabinoids. And many of our patients do find that it is more effective. But again, each person is different. So that takes us to the end of our question and answer period. I want to thank everyone for listening to this video. I hope you enjoyed it. I hope you learned a lot. Feel free to reach out with any questions, and we look forward to seeing you in our next episode. Thank you.